This talk is going to be about 9 slides, and it's a little bit dense in information. So the best way to kind of receive this information is through a little bit of an interactive approach. So if there is something that I'm talking about that doesn't make sense, please feel free to either remotely raise your hand or write something in the chat and let me know if you do have any questions, because this is really kind of just the start of a conversation of where our profession currently stands in the state of Oregon, where we want to go with our profession in the state of Oregon, how the OAA can facilitate that, and how the OAA can work with other organizations in order to facilitate it. So I'm going to share my screen. And again, feel free if you have any questions to either put them in the chat or remotely raise your hand. And I'll give an opportunity at the end of each slide for questions, as well as an opportunity at the end of the slideshow for questions. Give me one moment while I share my screen here. Can everybody see my screen? Yeah, great. Now, do I know how to play it? Slideshow. Okay, here we go. So we're talking about the current state of the acupuncture profession within Oregon as of 2023. And this is what the OAA has mostly on their radar. In order to fit this in an hour, I kind of put just what our priorities are and the things that I think affect the profession the most based on the feedback that I've heard either in our scope of practice committee, in our legislative committee, or just through members talking to me either through social events or through Facebook. So here's an overview of what we're going to talk about. First thing I'm going to talk about is a definition of terms. I think it is crucial for everybody to understand all the key players before we actually dive into how they affect us. I'm going to talk a little bit about the OAA organization chart because it has changed just a little bit. And different committees kind of do different things. We're trying to delegate out responsibilities so the board doesn't have to do everything. Or I'm going to talk about what essential health benefit is, and that acupuncture is an essential health benefit and how that kind of affects how we practice. I'm going to talk about provider non-discrimination law and what that means and how that breaks down into our profession. I'll talk a little bit about the legislative process in terms of how it affects us getting legislative measures passed, not in terms of what the actual process is that our lobbyists need to go through or that our legislators go through. I'm going to talk about OAA's legislative goals, so what it is that we have projected in our strategic plan for the next 5 years and 10-year goals, as well as what we're currently actioning. And then I'm going to talk a little bit about what practicing in Oregon looks like. And I know it does look different for all of us, but kind of what the overall landscape looks like to practice within Oregon. I have a call to action slide, and then I'll address a few questions. If I haven't addressed them already, if one of you don't bring it up, I'll address a few questions that people have brought up to me in the past. So a definition of terms. First and foremost, a regulatory body, a certifying body, and a professional body are all different. And they all have different things that they do in order to kind of guide a profession. So our regulatory organization in Oregon is Oregon Medical Board. And what that means is they interpret nuances within our scope of practice. They do not actually determine our scope of practice. That is done legislatively. So what they do is they say, okay, this thing might be broad. Is this like we have, for example, manual manipulation under the scope of, Chinese, or I think it actually says Oriental still in our scope, but Oriental manual therapy. And then they say, well, what is that? And they have determined that pelvic floor work is not within our scope of practice right now. So that's just one example of maybe one of the little nuances that they would determine and say, yes, this thing is, or no, this thing isn't. So the OAA works with the Oregon Medical Board basically to show patient safety as to why things should or should not be in our scope of practice, as well as telling people what our general education is around that. Because Oregon Medical Board does not currently have any acupuncturists on the board itself. We have an acupuncture advisory committee, and that is made up of both acupuncturists and medical doctors, and they meet once a quarter and they determine how they're going to advise Oregon Medical Board on these issues, but we don't actually have a vote. And Oregon Medical Board cannot change that. That is a legislative thing. So basically the state of Oregon would have to legislatively say, Oregon Medical Board, now you have to have an acupuncturist to sit on your board. It might change the total number of board members. It might not. It just depends on how they write up that rule. And then Oregon Medical Board would implement it. So if we do want representation on Oregon Medical Board, that is not something that we go to Oregon Medical Board for. So that's just a little bit of clarity of where those lines actually lie. A certifying organization is right now NCCAOM. And what they do is they basically tell our regulatory organization that we are qualified through education in order to practice with our licensure. In some states, the NCCAOM exams are okay in and of themselves. In the state of Oregon, we're okay as with only 3 of the 4 potential exams. We don't have to take the herbal exam. But in other states, they say, okay, you need to have NCCAOM certification, and then you also have, XYZ as additional training. And this really comes into consideration when we're talking about trying to interpret either labs and imaging or the potential for point injection stimulation into our scope of practice. So Oregon Medical Board right now says those are not interpreted as part of our scope of practice. And the reason that they aren't is because we don't get proper education or certification in it. So the OAA can go to NCCAOM and say, hey, do you actually certify people on this? Do we have to take exams on this? Are we getting adequate amount of testing on this? And if we can prove that that's true, then we can kind of go back to Oregon Medical Board and say, hey, maybe we need to change this interpretation. So that's how they kind of interplay. And then a professional organization is Oregon Association of Acupuncturists, which you all know, or the Acupuncture Society of American Society of Acupuncturists. So that's our national sort of professional organization. And what we do is we advocate for the profession. We ensure that there's education around the profession. We try to take the rhetoric around the profession and take control of that. So that way we ensure that we actually have rights within our profession. We have a scope of practice within our profession, and that acupuncturists can actually continue to do this. So professional organizations are led by the people in the profession. So we are all acupuncturists. We are all volunteers, 100%. The OAA is very fortunate that we can have a hired administrative support. Most state organizations do not have the luxury of that. And that takes a huge administrative burden off of the rest of us that are volunteers. And it is really important to back your professional organizations, both the OAA and the ASA, because the advocacy that they do in this country is not cheap and it is not quick. So a lot of people get burnout, and a lot of people, they try to give their all to better this profession, and there's a lot of barriers. That's just kind of the way that working in the current American medical system works. There's just a lot of people who don't think it's in providers' best interest to treat patients or for patients to really get healthy. That's my own personal opinion, just so everybody knows, but backing your professional organization really helps us take the rhetoric so other people don't determine the rhetoric for us. Like I was saying, Oregon Medical Board, they don't have certain interpretations in our scope of practice, which we know that we probably can safely do. We've been educated in, or we've received additional training in, and we feel like we safely can provide care to patients. And Oregon Medical Board, always errs on the side of safety and says, no, we can't. So then it's our job as a professional organization to prove that we actually can. So that's a definition of terms. Does anybody have any questions yet? Cool. So the OAA itself, we are made up of 9 board members. We have 4 members on our executive team, Myself, I'm Amber Redding. Jennifer Briggs, she's on camera right here as well. Our secretary, Kelly, and our treasurer, Darby. And then we have 5 members at large, but all of them take on different hats, and all of them are also working on multiple committees. And just saying that they're a board member at large, I don't think really does the amount of work that they do justice. So they all deserve shout outs for everything that they do. We have a wonderful student representative. She is a student at OCOM. At this point right now, NUNM did not have an incoming class for Chinese medicine. So we do not have a student representative at NUNM right now because they don't have a Chinese medicine class this year. And then we have an alternate board member and a remote administrator, Brittany, who like I said, takes a huge administrative burden off the board and really helps move a lot of things forward that we wouldn't be able to do if we didn't have her. So she's a great asset. We have a legislative committee, and I think Elizabeth is on. So she's here and could maybe, if I misspeak about anything legislatively or need more clarity, she can maybe give some more clarity on that. Our scope of practice committee chair is Brian Crawford, membership committee, Andrew Vu, and research committee is Kelly Eisman. As you can see, most of our committee chairs are also board members. So like I said, everybody's kind of taking on multiple hats and doing as much as they can for this organization. Yeah, any questions? Cool. So essential health benefits. I want to talk a little bit about this because essential health benefits does not mean that we are mandatory coverage. I hear a lot of verbiage around there saying, hey, we're mandatory coverage. Why aren't we being covered? And we're not. That's just not what this means. So what it means is that we are included in all individual and small employer health plan benefits in Oregon. It is required that at least 12 visits of acupuncture are covered, but there are no definitions in this about parameters for care or barriers that these insurance companies can put to care. So there isn't anything about a referral process or a pre-authorization process or only specific conditions, anything like that. It also excludes all federally funded group plans, and it excludes all privately funded large group and individual plans. So how that breaks down in the state of Oregon is roughly 70% of individuals who are covered by medical insurance do have coverage for acupuncture for up to 12 visits a year. Now, part of the 30% that are not in this medically insured in the state of Oregon are our Medicare providers. And that's actually a huge portion of the 30% that are not covered under the essential health benefit, because that is a federally funded plan. So do understand that more people have acupuncture coverage actually than what this looks like. And this means that 70% of individuals are paying premiums, or their companies are paying premiums, health insurance premiums, in order to pay for acupuncture services, or the state is paying that healthcare premium. So if people are on Oregon Health Plan, then the state's paying that. So that means that there are probably, I think the last breakdown that I heard, probably about 15% of Oregonians that don't have some sort of acupuncture benefits that are covered by medical insurance, which means that the rest of us do. And that also means that they want to access their benefit if they're paying for it, or if their employer's paying for it, they want to access those benefits. And that also means that they might not want to pay out of pocket. Okay, any questions on what an essential health benefit is, or how it breaks down and how acupuncturists are affected?
So Amber, I do have a quick question. You mentioned the prior authorizations and kind of some of the barriers to care. So just because it's an essential health benefit doesn't mean like that the insurance companies can't erect those kinds of barriers. Did I hear that right?
Correct. So it's actually really common for insurance companies, like if any of you take any of the ASH network, they oftentimes say, okay, you get the first either 3 or 5 visits, depending on how acute it is and how severe the pain is. And then you have to go back through the EviCore process and you have to reauthorize visits, and you get 3 more visits, and then maybe you get 3 more visits. And it's a huge administrative burden for practitioners. And it's really frustrating for patients too, because it disrupts treatment plans in a really big way. So if you put somebody on a treatment plan and you say, best treatment is for you to come twice a week for the first 3 weeks, and then once a week after that, or then we'll reassess, or whatever your treatment plan is, and you need to get, go through an EviCore authorization, which takes time. And then oftentimes they deny it. I've personally, in my practice, I've never had a ASH plan that has approved more than 2 of them. So I'll get the initial, and then I'll get another authorization, and then 1 more, and I won't get any more after that, which usually caps people at about 8 visits in my practice. So then they need to fight that, and a lot of patients aren't really educated on how to fight that or know what to do to fight that. And that is definitely a huge concern, and something that we're hoping to take on legislatively, because when we tried to take it on with the insurance companies in the past, it hasn't been very effective. We're also maybe hoping to work with DCBS, which is the, Department of something and something Consumer Affairs, but that's who in theory regulates insurance companies in the state of Oregon. And I say in theory because historically they have regulated consumers, and they have not regulated bigger industry. And I met with them about a month ago, maybe 3 weeks ago at this point, as a pre-meeting to set up a quarterly meeting with them to talk about some of the issues that healthcare providers have with insurance companies, that we're not really able to, there's no process to be able to report when they are doing things that are either illegal or big access to care issues. Yeah. Okay, moving on. Oh, did I skip one? Yeah, here we go. So provider non-discrimination law. This is another thing that's really important. This was passed federally, and it says that all providers who are legally qualified to perform a service must be able to do so, and that provider must be able to get paid for it. So if an insurance company says, I cover 97810, they have to allow anybody who scope of practice allows them to do 97810 in order to perform it. Now, in the state of Oregon, it is not in the scope of practice of PTs or DCs, and only for dual licensed for naturopaths. So MDs can practice acupuncture in the state of Oregon, and acupuncturists can practice acupuncture in the state of Oregon. And there is some gray area. My understanding is that there is some gray area when it comes to nurses if they're practicing under a doctor. So nurses and physician's assistants, if they're practicing under a doctor, my understanding is that they can also do acupuncture in the state of Oregon. So that means that if an insurance company pays for it, they have to cover all of those people. Some insurance companies do adhere to this, but a lot of them don't, because the enforcement is very challenging. That's what I was talking about with DCBS before, is that historically they really haven't regulated insurance companies, and there's no process for us as practitioners or for patients to really report if an insurance company isn't adhering to something that is a legal requirement. So that's part of the conversation that I opened up with DCBS, where I said there needs to be a really clear avenue for us to actually report things when there isn't, like, and I give them a very clear example, for massage therapy, this happens all the time, where they say, okay, massage therapy is covered, or manual therapy is covered, but only if it's done in a physical therapist's office, or only if it's done in a chiropractic office, and not if it's done in an acupuncturist office. And if a massage therapist is licensed to be able to provide the service, they have to be able to get paid, whether they're working in an acupuncturist office or whether they're working in a chiropractic office or PT's office. It doesn't really matter. Or if an acupuncturist wants to be able to do the manual therapy, if they cover manual therapy for PTs and they cover manual therapy for chiropractors, then they have to cover it for acupuncturists. That's as the law is written right now. What is not in the law right now is that, and this is, I put this little bit at the bottom where the chiropractors tried to make a point about discrimination in 2019, just so everybody can see that this is a pressing issue for more than just acupuncturists. What they have are what are called relative value units. And that means that not all providers' time is valued at the same rate for reimbursement. Now, this is something that is actually determined federally through CMS. And they say that a doctor's time is worth more money than an acupuncturist's time. So the reimbursement rates from some insurance companies, including through Medicare, is more for an MD practicing acupuncture than an acupuncturist practicing acupuncture. And this is concerning because we do get more training in providing acupuncture than a doctor does. They say that there's also risk associated, but we're taking on the same amount of risk as a doctor as if we're sticking a needle in somebody. So that is not something that the state association is able to help with. That is something that would have to be taken on federally. But that is something that is a high priority for chiropractors right now. And because it's a high priority for chiropractors right now, acupuncturists, we don't have as strong of an organization. We are a newer profession in the state, in America than the chiropractors are. So we are not putting this as a legislative priority right now, but it is definitely something that everybody should be aware of. And it's absolutely something that affects acupuncturists.
Okay, so quick question again, Amber. This is where actually the ASA comes in, isn't it?
This would be where the ASA comes in.
So these are the people who are actually advocating for us at a federal level. And we are all by default members of the ASA because we are members of the OAA. Yes.
Yeah. So the OAA a number of years ago decided to join the federation of the ASA. That means that we pay dues to the ASA. That's part of your dues go to dues to the ASA. And by supporting the OAA, you're already supporting the ASA. We have one voting member per organization that gets to vote for the ASA. Our previous president, Ross, is the primary representative for the state of Oregon. And then when he steps down, I will be the primary. So the previous president of the state association automatically becomes the primary representative for the ASA. That's how it works in this state. And we are all automatically members. What that means is that your voice counts on what we're doing nationally. So if you think that there is something that is a priority nationally that maybe is not on the ASA's radar, please talk to the OAA about it, and we will make sure that it becomes on the radar. I'm an alternate member. I go to every one of the council meetings. I'm on every single one of the listservs, and I'm very active in communication with the ASA. So please just bring it to our attention. No matter who you email or talk to at the OAA, it will get back to me. They'll kind of, or me, myself, if you can find my email, definitely email me, president@OregonAcupuncturist.com, and it'll get to the ASA. Yep. Any other questions about provider non-discrimination law? Cool. This is something in terms of the enforcement of it that has been really challenging and has not been able to be enforced really since it became a law. So that is something that we're trying to work with DCBS. My impression of DCBS, based off of the meeting I had, is that they are setting up for the first time some of these lines of communication and some of these avenues to report. So it might be a slow process. So the more pressure we can put on DCBS to do this, the better it will be, which is part of the quarterly meeting that we want to establish. And if anybody wants to be a liaison on behalf of the OAA and really put pressure on DCBS, please, please, please volunteer and do that. That is something that needs to be a priority, in my opinion. And as you saw, all of our board members are wearing a lot of hats. So we don't want anything to fall through at any point. So if you feel like you're the person that could really emphasize that and push that, please, by all means, volunteer. It would be helpful. Okay. So the legislative process. The legislative process is complicated in this country. It is slow in this country. We have turnover of our district representatives. We have turnover of the people at the OAA a lot. We have turnover in our lobby firm. So all of this means that this is something that we always need to make a priority. This is always something that we need to continue to push for. But it also means that what we ask for today, we might not get the same answer as when we asked last year or the year before. So we always need to re-justify, and we always need to re-emphasize why a policy should be placed, especially if we're trying to justify legislatively regulating a private corporation. In America, we do not like to regulate private corporations. That is something that's not well received locally or nationally. That's not something the average voter wants either, unless they can really see why the justification is there. So being a capitalist country and being a country that prides itself on having certain freedoms, it is crucial for us to really say, if this is unregulated, this is how it breaks down to other people. So what that means is having big asks like, we need higher reimbursement rate because we cannot afford to live with low reimbursement rates. We need to prove that we are getting low reimbursement rates. We also need to prove that we take away financial burden from an already really burdened medical system. We need to prove that other people are making money and sacrificing us as providers doing it. So these are things that need to be justified in order for us to put harsher regulation in place or to justify harsher regulation. So if it seems like what we are pushing for are kind of like small fries, it's because they kind of are small fries, and we have to take this first step or we're never going to traverse the hill, right? So basically what we are pushing at the OAA is to show that low reimbursement rates hurt patients. We're unable to provide best care if we aren't able to actually give the care that is tailored to the patient. As we all know, everybody needs different things. So having all-inclusive services doesn't really serve patients. I'm thinking about one insurance company in particular. It's a third-party payer actually. And the third-party payer has all-inclusive for a very low reimbursement rate. And what that means is if somebody needs manual therapy, they need herbal treatment, they need a second or third set of acupuncture, I don't get paid for that. So I'm not able to actually give best care to these patients. And these patients, like I said before, they pay high premiums, or whoever their employer is paying a really high insurance premium. And they should be able to use a benefit that is an essential healthcare benefit. It's a right for them to have this benefit. And if they need to pay out of pocket to actually get best care, then they don't really have a right to the benefit that they're already paying for. Employers us as acupuncturists, many of us are employers. We might have staffs with other acupuncturists on it, or massage therapists or office staff members, and we're not able to provide livable wages for our staff. As we all know, cost of living has increased. It's increased over 10% just in the last year, and reimbursement rates have stayed stagnant or declined over the last 10 years. We all know this from our own data in our own clinics. But there's no way to really show our legislators that, yes, this data is true in an unbiased way currently, because they say every single one of us, because we are stakeholders in our own clinic, that we have biased information. So what they really need is a third party neutral. And I kind of say neutral because I don't think any government agencies are fully neutral, but they need a neutral investigator to publish unbiased data. So what we are asking for is DCBS to go through, and what they would do is they would actually hire a contracted party. So the current people in DCBS would be allotted a specific amount of money. And our current bill, I believe, is about $1 million. It's not very much. We pared down our bill significantly financially from last year. Even though we added other medical providers to our bill, we pared it down significantly to say, hey, over the last 10 years, what have the trends been for very specific codes? And we're looking for the top 3 codes for every provider. So for acupuncturists, it's 97810, 97811, and we're not doing electro codes. We're just doing those 2 codes because we know that it's going to show the same data. The data is going to be stagnant or lower reimbursement rates. So it doesn't matter how many codes we dive into, because the point of this bill is literally to just justify something further. So once they know that things have stayed stagnant, despite operating costs going up, despite insurance premiums going up, despite access to acupuncture going up, and they already know that the validity is there. They know that this is effective, non-opioid treatment for pain management. It's really big in the VA. It's big for Medicare right now. They already know this. We don't need to justify that. Previous people in the organization have already done that, which is amazing. So we've already been on this process for a while. This is just the next step. And we do have support from the medical community. It was originally only intended for integrative medicine, for LACs, DCs, NDs, and LMTs, but the physician's assistants actually came to us and said, hey, we want on this bill as well. Then nurse midwives, dentists, podiatrists, and now even the MDs. So for last year, it was voted unanimously to pass this bill, but it was not funded because it was not very specific on how much this bill was going to cost, and the cost of the bill was too high. So even though it was unspecific, it was too high. So it wasn't funded. It was shot down in Ways and Means, in the Ways and Means Committee, but it was unanimously voted by our legislators. Again, we have different legislators now, right? We have different district representatives. So who knows what's going to happen now? But it is really important that we emphasize, again, this is a very small ask, which could be a big solution to a huge problem. Yeah, big first step towards a solution to a big problem. So the OAA's legislative goals is to use this information gathered from our current measure to then justify cost of living increase. What we want to do is we want to justify at least a 3% cost of living increase every year, but we would need to see something larger initially in order to make up for the last 10 years that we know things have been stagnant or they've gone down. And there is no reason that we should have our medical reimbursement rates, insurance reimbursement rates decrease without adequate justification from the insurance companies, and saying that they want to lower the financial burden of the cost of healthcare is not really adequate justification, because there is no direct correlation between what providers are paid and what insurance health premiums are. And our bill will show that as well, because despite health premiums skyrocketing over the last 10 years, our reimbursement rates have been stagnant or decreased. So it will show that there is no correlation. So that will not be a good justification. So we're hoping that we can use this to then justify, this would be, if it passes, they have to get, DCBS has to get the information back by 2024. And then in 2024, we would then introduce a new bill for a cost of living increase. It would be the first in the nation to have any sort of cost of living, legislative cost of living increase for a privately funded insurance company. So we are kind of treading new ground. We are not the only state working on something like this, just so everybody knows, but we do have some more traction than most other states, because this is something that has been being worked on for a long time, and that we have restructured, regathered, regrouped, restructured, regathered, regrouped many, many times over. So we're hoping in the next 3 to 10 years to then get something passed for a cost of living regulation. Something for us to think about also is antitrust laws. So our antitrust laws are federal laws that say that independent contractors are not allowed to collectively bargain against corporations that they're working with. Now, these are intended to prevent monopolies within specific organizations or specific industries. The law is very, very vague. And in the country that we work in and we operate within, it means that vagueness in it means that those who have the legal ability, the litigious means, can fight it. That's basically what that means. So there's nothing specifically that says acupuncturists can't band together and negotiate insurance contracts. It's just a very gray area in antitrust laws that can potentially open us up to a really big lawsuit, which is why the OAA cannot organize people to negotiate insurance contracts at this time. I will say there are members of the OAA working with lawyers on their own in their own private clinics, myself included, that are talking to them to try to negotiate contracts with insurance companies, because many of our contracts, as we all know, are very predatory. And they're predatory not only with low reimbursement rates, but they're predatory with high administrative burden and dictating clinic policy, which, if we are truly independent contractors, in my opinion, that's illegal. You telling me that I cannot charge a no-show fee when a patient doesn't show up, but I can't charge the insurance company for that either, is dictating my clinic policy in a way that ultimately does not allow me to stay in business and is very predatory towards providers only. Because whether that patient shows up in my office or not, the insurance company has already made their money. They already have their insurance premium. So not allowing me to charge patients or me to charge the insurance company is predatory. So there are some of us in the organization that are working with lawyers. Many of us don't have big enough clinics, or with their independent contractors for other clinics, or their sole providers. And I do think it's important for those of us who are able to fight for, the larger picture to do so, or to network with each other, which you can do through social events in this organization, to network with each other and see who's working on some of these issues and whether or not we have kind of the same issues we're working on, so we can work together and spread some of that burden, some of that financial burden, litigious burden, administrative burden that comes with negotiating with some of these insurance contracts. Because as we have seen, in the previous slide, and as I've been harping on, legislative things are slow, glacially slow. They really are. The reason that we are at the point right now where we're trying to justify this study is because we have all these stepping stones in place that the OAA has already worked on in the past. Acupuncture is effective. It's medically effective. We all know that. The state of Oregon knows that. We are regulated by Oregon Medical Board, which means we are seen as medical providers. We are not self-regulating, which is actually, to justify something like this, really important, because it shows that we are not biased, right? We're working with other medical associations because we have good networks and those sorts of things. So these are things, being an essential healthcare benefit, having Oregon Medicaid and now federal Medicare cover acupuncture. Those are essential things that allowed and paved the way for us to be able to now say, okay, we need this comprehensive review so that way we can justify something larger. So every one of these things has been stepping stones. They have been small steps, and I understand that, but that's the process. It really is. And if you ask for a bigger step, which we have in the past, people literally laugh in our face. I'm not kidding. It has happened. So if there is something in this process that you think can be moved quicker, if you have this golden idea on how to, work in the system that we're not seeing, please join a meeting. Please let that be known. I mean, we really are an organization of acupuncturists trying to better this profession. So that's really that's the main goal. And the more people that are involved, the better, in order for us to kind of get ideas and work within the system that we're already in, because we don't determine the American medical system, but we do determine where we fit in it. Any questions about OAA's legislative goals? Cool. Okay, a little bit about practicing in Oregon. So we are regulated by Oregon Medical Board. Like I said, that is something that in the past the OAA has thought a lot about. Should we have our own board? Should we not have our own board? What are the pros and cons of us having our own board? If you want to legitimize the profession as a medical profession, it is better that we are regulated by Oregon Medical Board. Ultimately, that was an argument that won out historically within the OAA. And now Oregon, at least temporarily, these things change. At least temporarily, Oregon has put a stop on creating new boards. So even if acupuncturists wanted their own board in the state of Oregon, that will not legislatively happen right now. That is something, for my understanding, the main reason is for funding, actually, because it costs a lot of money to upkeep a board. And my understanding is Oregon will not fund it at this point. And we are, as everybody knows, headed for a recession, and we are in a cuts year. We'll probably be in a budget cuts year next year and the year after also. So asking for us to be in our own board is really a energy that is not well spent. So we are regulated under Oregon Medical Board. We have an acupuncture advisory committee. Historically, if the advisory committee has advised Oregon Medical Board on a specific issue regarding acupuncturists, Oregon Medical Board votes in favor of whatever the advisory committee says. The problem with having an advisory committee and not having a seat on the board is that they don't hear all of the discussion that happens around it. And occasionally there are things that maybe get missed by the acupuncture advisory board, aren't brought to their attention. And then there are interpretations around our scope of practice that happen that aren't specifically advised, and they're voted without they're voted without a lot of insight or a lot of understanding about the profession. The other hard thing with acupuncture advisory committee is that there are MDs and there are acupuncturists in it, and sometimes the MDs are a little bit louder when it comes to safety concerns for patients than the acupuncturists are. So it is really important that we have strong acupuncturists on the advisory committee, which we do have right now. There is one spot on the advisory committee coming up this year, and there is an OAA board member that's very interested in that spot. If you're interested in that spot, by all means, run too. That is an appointed position, the state appointed position. So you put your application in, you justify why you want it, and then the governor's office appoints somebody to that position. Right now, our scope of practice committee has a really good working relationship with the acupuncture advisory committee. With the chair of the acupuncture advisory committee, his name is David Berkshire, and he works with Brian Crawford a lot for what it is, if we want to broaden any of these interpretations of our scope of practice, what it is that they want to see, the advisory committee wants to see, in order to actually advise Oregon Medical Board to broaden some of these interpretations of scope. So we are working with that. And if that's something that is interesting to anybody, by all means, join Scope of Practice Committee meeting and see what we're talking about. We do have, well, we were asked to join another bill to ask for a seat on Oregon Medical Board. We were asked by the physician's assistants because they wanted to justify getting, I believe, actually 2 more seats, and they couldn't justify getting more seats if acupuncturists don't even have 1 seat, because we are the only profession regulated under Oregon Medical Board that doesn't have a seat on the board right now. And we jumped on that bill. We said, absolutely, yes, we want a seat because we want to be represented on the board and we want a vote on the board. And there hasn't been a lot of traction around that bill measure. So I'm not sure where that's at. Last I checked with our lobbyist, he was like, well, they're not really doing anything and it's not going to be voted in. So that isn't something that we've put our legislative efforts into, because we really think that getting some regulation around insurance companies is going to have a bigger impact on acupuncture sooner. So that's where we're putting our legislative effort. And that is something that the board voted on. And that is also something that our legislative committee talks in depth about. So we kind of have to pick and choose our battles when it comes to that. And regulating insurance companies is a battle that affects us a lot more as a profession and our viability to stay in practice much more than having a seat on Oregon Medical Board. But that is something that is on our radar. And that's something that we might choose in the future to pursue. If we do pursue a seat on Oregon Medical Board, it's very clear to us that the Acupuncture Advisory Committee would be dissolved. And there are pros and cons to that as well. And basically, I talked with the podiatrists, the leaders of the podiatrists, when they got a seat on Oregon Medical Board, and they said it was absolutely invaluable and they needed it, and they never looked back. So they do recommend that we push for that in the future. And that might be, while this study, hopefully our bill gets passed, and while the study is happening, that might be where we put our efforts in the meantime. For positions that are available, could someone please post a list of spots and who to apply? Kayla, are you talking about for Oregon Medical Board specifically, or are you talking about within the OAA for positions that are available?
You've mentioned multiple positions that are available, and just because I'm doing stuff, I haven't been able to catch everything and everywhere that it would be available. So if there was potentially some sort of short, easy list that you guys could do, that you could send out, that would be fabulous. Yeah,
absolutely. Thank you for that feedback. Brittany, do you mind taking a little note of that to make sure that we have something that's a bit comprehensive? There is in our quarterly newsletter, which is, I know it's a little late coming out, but we had an administrative turnover. And that's going to be coming out at the beginning of next week. And we do have a list of a few things in there that are needed, including board positions that are coming up within the OAA, some executive team positions that are going to need to be filled. There is an ask from OCOM for integrative clinical settings that interns can come and work and get intern hours. So that's going to be in there. And then we can definitely post about this Oregon Medical Board position as well. And we'll try to put links for all of that and information in our newsletter. But that's also something we can probably put under our resources page for our members only page. So we can update our website a little bit on that as well. Yeah.
So, and then Amber, if somebody wanted to, you had mentioned before about needing people to talk specifically to DCBS. Mm-hmm. If somebody was interested in that, should they just email you or?
Yeah, so our legislative committee, we just voted on our last board meeting, and we haven't actually told them yet. Well, Liz knows, but nobody else knows. We are now Advocacy Committee, and that is something that will be filtered through the Advocacy Committee. So that could either be, an email to Elizabeth, or that can, even our info email. Like if anybody wants to anything like that and they don't know where to go, start with the info email, talk to the VP, talk to me, Anybody who sends an email, like we regularly are in our emails. I might be the least regular, but I'm still in my email 3 times a week. So, but we can put DCVS on our newsletter too. Yep, that'd be great. Okay, cash practice versus insurance-based practice. Most of this conversation has been really focused on, if you're in Oregon, accept insurance. And that does not mean that you have to have an insurance-based practice. You can be quite successful with a cash-only practice and probably way happier. What it was emphasizing is that our profession in the state of Oregon, if we want to fully integrate into the medical system, which we do, because that is what is best for the future of our profession, we need to make sure that we're advocating for reasonable accommodations within our insurance-based practice. That means that we need to make sure we're making livable wages. That means we need to be breaking down breaking down barriers to access care. That means that we need to really fit in the American medical model. And by we, I mean the collective greater profession. I do not mean how you want to practice in your own practice. My current clinic that my husband and I have in Hillsborough, we are an insurance-based practice. I personally do cosmetic acupuncture, and that is not insurance-based at all. It's 100% cash. So I have a little cash niche underneath an insurance-based practice. There are so many beautiful ways for us to work and for us to serve patients, and patients will find what they want. But if we don't have a space where enough practitioners are really integrated into this medical system, other professions will do acupuncture. They absolutely will, because it is very, very effective. And it is very low risk. And to many other medical professionals, they think it's really easy, which we all know it's much more complicated than that. So if we don't take that role and we don't take the rhetoric around what the acupuncture profession is, somebody else is going to take our scope of practice and they're going to water down our medicine. So it is crucial for us to do that. Like I said, you want to have a cash practice, there's a spot for you. I guarantee it. There really is. Or you want to have a hybrid practice, there's a place for you. Or you want to work it fully integrated into a hospital system, there's a place for you too. There is a place for anybody to run practice however they want to. But for the future of the profession as a whole, where 70% of insurance covered people have access to acupuncture on some level, and actually higher than that, because once we become Medicare providers, we'll be open to that demographic as well. So it's actually higher than that. It's really very, very important that we ensure that there's a place for acupuncturists within the current medical system. As broken as the system is, we need a place for it. It is also important to do patient education. Patients do not understand the nuances of insurance. They don't understand the nuances of the legislative process. They don't understand what a regulatory body is versus a certifying body. They don't get it. They do not understand it. So it is really important for us to help them in a kind and compassionate way when they say, well, I don't understand why you don't take my insurance, for us to educate them and say, we can't afford to take your insurance because of the low reimbursement rates. And it is okay to say that. Whoever the insurance company will tell you, you can't say that to a patient, but you can, especially if you're not in contract with them. There are no legal ramifications. You can tell them it's because of low reimbursement rates and you can't afford to pay yourself or your staff to take that. And if they want to do more to help the future of this profession, to ask their state representatives to open do a public hearing on this, show up to a public hearing, tell them why it is important that our providers have rights when it comes to insurance companies. It's also important to do provider education, educate other medical providers that are integrated into hospital systems and maybe don't see the challenges that solo practitioners or clinic owners have. Educate them as to why you can work with some networks and you can't work with others. Educate them why you chose to be a cash practice. Educate other providers also, because we are a team, 100%. Treating patients, it takes a village, and we are a team of healers that working together. So that's what practice in Oregon looks like from the OAA's perspective. Any questions about that? Cool. Call to action. This is really in OAA's mind the most important slide. Everything's just kind of leading up to this. Get involved with the OAA or the ASA and help shape this profession. If we don't take the rhetoric back, like I said before, other people will. And it is happening, and it is happening very, very fast. We feel fairly secure, collectively feel fairly secure in the state of Oregon because we have interpretations around dry needling and around acupuncture that don't allow a lot of other professionals in it. But that is not very secure, and it's not legal either. That is an interpretation. That is something that can be fought and is being fought in many, many other states. So get involved, take the rhetoric, be the kind of person that says, well, I want a future that looks like this, and I want the people who are graduating to be able to come out of school and pay off their student loans. I want it to be easier for them than it was for us when we graduated, and help to build that, because this organization and the ASA, we are working for every single acupuncturist in this country. That's really what we're doing. And if you don't state what your voice is or what your opinion is, we can't work for you, because we don't read minds, right? So it's really important. If you want to join a committee, it's an hour a month plus some emails. It's not very much. If you want to, take on a little bit more of a project, you can join a committee and then be delegated one of their little projects, like a letter writing campaign, or, hosting a social hour, or hosting a CEU. We're always looking for teachers for continuing educations too. And the OAA pays for the NCCAOM part of it already. So it's really cheap and easy for you, but help shape the profession, because whether we like it or not, we are the current practitioners and we are the future of this profession. And we want to ensure that there is a future, a non-watered down future for this profession. If you can't do that, or that seems like too much with everything else going on, which we do understand, we all have busy lives, answer the call. When we ask you to participate in an email campaign, take a few minutes and do that. When we have an educational or a social event, show up to those. A lot of them are virtual. A lot of them you can kind of keep your mic off and keep your camera off and just kind of go in and out a little bit. A lot of them are recorded. So show up to those. They really, really help. And finally, and very important, donate to the PAC, donate to the OAA. Advocacy is expensive. I cannot, and trust me, I do about 20 hours a week for this organization and I don't get paid a penny. I'm happy to volunteer my time. Many of us really are happy to volunteer our time. The money goes to paying our admin, which is really important. Like, she is valuable, trust me. Paying our lobbyists, which is important. Giving back to the legislators and their campaigns when they back our legislative efforts. These things are very expensive, and we're hoping that we might be able to have a lawyer help maybe with some of these insurance things that are moving very slow legislatively. So if that's the case, then that's going to be very expensive too. Or better yet, find outside of the profession, find people to be able to donate. We're always looking for corporate sponsors. We're always looking for, other people who might have a vested interest in healthcare and healthcare reform that aren't within the profession. So we're not solely funded from our profession. Okay, we're at time right now. So I understand if people need to go, or I can go over a few questions if people have questions, or I can answer these questions that people have already brought up to me in the past. It's kind of up to people. So first one, I'm sorry, go ahead, Jennifer.
Sorry, just administratively, for people who want NCCAOM credit, make sure that we get your first and last name and your NCC AOM number, because otherwise we can't get you the credit. So just
Thank
wanted to
you.
remind everybody before you drop off.
Thank you. So I'll just go over these questions really quick, and then if people do have questions, I'm happy to answer them. Is there a future for acupuncturists in the U.S. medical system? Yes. Yes, there absolutely is. And we have a lot of momentum, both within the state and nationally. If you have not already seen the ASA town hall, the last town hall that they did talking about our Medicare bill, definitely watch that. What they are saying in that town hall, which is the same thing that we're saying, is if we don't take on the verbiage around what it is that we do, and if we don't take hold of our own profession, somebody else will do it for us. Will there be acupuncture in the US medical system moving forward? Yes. Will it be acupuncturists that do it? That's up to us. That's really up to us. It's up to us to make sure there is a place for it. And it's up to us that we emphasize how necessary it is to have licensed and qualified people to do this for patient safety, right? What can we do as professionals and students? It's really not that hard. Show up to a meeting, make your voice heard. Email a legislator when we say, hey, here's your call to action. Pay a very small amount of money to be part of your state or professional association. It's very minimal. So what it is that you can do, I had a whole slide of call to action. It's not very much. If you know that you have a month where you're like, hey, I have a month where I've got 10 extra hours this month or 5 extra hours this month, reach out and be like, what can I do in this time? Is there anything I can, because trust me, we always have 100 different things going on. And the more people who are participating, the more we can accomplish, because all of us are volunteers. So that's absolutely what you can do. And then, is it possible to practice outside the US medical system and support the overall growth of the profession? Absolutely. If you want to practice really esoterically, if you want to practice, I have a really good friend who pretty much just does like Batsa and Feng Shui, but he's a licensed acupuncturist and he makes a good living. He really does, but he still supports the professional organization and still understands that we're living, whether we like it or not, we are living in this healthcare system or sick care system, however you want to see it. And larger reform is needed. It absolutely is. But what we can do about it right now are these small, incremented steps. And then what's happening nationally, again, look at the ASA website. What they're trying to do right now is they are working on a bill to make acupuncturists Medicare providers. Medicare already covers acupuncture for low back pain up to 12 visits a year. And then if they're showing improvement, 8 more additionally to that. Medicare reimbursement rates are higher than our third-party administrator rates right now. They're higher than ASH, they're higher than CHP. So they're not great. They're not terrible either. And this opens up the ability to go out of school and get a lot of hands on a lot of people right away, which is amazing and not an opportunity that was given to me when I graduated. So that's what's happening nationally. Please support that, and please support your organizations as well. Any other questions? Okay, I'm gonna stop sharing my screen. Thank you everybody for showing up. Like I said before, this is recorded. We're going to put this on Zoom. If anybody has any questions that maybe they didn't want to bring up or we ran out of time, feel free to email info@OregonAcupuncturists.com. Feel free to email president@OregonAcupuncturists.com. Feel free to show up to one of our meetings under your members only page. All of our meetings are posted there. Zoom links are posted there. And we really do want to hear from all of you. Even if you don't want to be very active, can't be very active for whatever reason, we want to hear from you. So thank you for your time. I know it's a Sunday morning, and have a great day. Feel free to reach out anytime, okay?